welcome everybody. I'm Dr. Tommy Wolf.
I'm Dr. Vanessa Rodriguez.
And today we're talking about back pain.
Yes, so we know some of you out there are probably experiencing back pain right now, but you guys are not alone. Half the workers in America today are experiencing back pain. It's actually the #1 leading cause of disability, and we're spending over $50 billion in America on dealing with this issue.
Get your billions back, America.
Absolutely. So we're here to give you guys some reasons of why you could be experiencing that back pain, but more importantly, maybe giving you an answer to the cause and things that you can do to correct it.
Yeah, because a lot of times we see is that people don't understand the actual condition they're dealing with. Dr. Dennis Turkey is a professor of anesthesiology and pain research, and he wrote an article, and in the article he said it's good for the public to know how little we know about back pain. And he said the problem is when they go to the doctor, the first doctor's visit, 85% of the time, they don't know what the cause is. So they can give you medication and stuff for the pain, but we want to get down to the actual cause of it.
Right. So some of the small minor causes that could be causing your back pain are, of course, things like car accidents, major traumas, maybe even playing sports as a kid or even as an adult. But even things like repeated postures, sitting at a desk, having that gravity push down on the low back and causing it to feel the tightness, feel the pinching, feel the even numbness and tingling going down your legs.
Yeah, and so anatomically, I mean, you could have a strained muscle. Mm-hmm. Right, so you can do some stretches, some strengthening, overall body strengthening. The stronger you are, the more you're able to handle the pain and stuff. But if you are having those postures, most of the time it's due to a misalignment of the spine, a subluxation, that's putting pressure on the disc, putting pressure on the nerves. And that's what leads to those bulging discs, those herniated discs. You know, we see a lot of people out, and when we talk to them, they say, oh no, I have a bulging disc. I've had an MRI, I got a herniated disc. And it's like, okay, you know, it's not the end of the world, but a lot of people think just because they have that, you know, they're just on a time schedule waiting for surgery. And it doesn't have to be like that.
Right, and it's really important to get your low back checked for the alignment of the spine, because if it is putting nerve impingement or interfering with the disc, those nerves that exit the low back also wrap around to the front of your body, which controls your digestive system, your reproductive organs, even sending the nerves down to your legs and feet. So if you're experiencing symptoms like irritable bowel syndrome, you know, Crohn's, any sort of digestive issue, or even reproductive, ladies, if you have any problems with your menstrual cycle or infertility, checking your low back is definitely important.
Right, so that little low back pain that you just kind of deal with on a daily basis, you want to make sure that you get that checked out before it actually becomes a big problem. You know, back in a couple years ago, there was 300,000 fusion surgeries, and on average, it costs around $59,000. So let's not wait until that point. Let's get it checked and get it corrected. So again, not only you can move and motion with your spine, but the organs, because we're dealing with the nervous system, the organs can function at their highest ability.
Yeah, so some of the things you can do right now are just simple strengthening exercises. So again, you've heard keeping your core strength up is really important, and that's going to help stabilize the backbones and muscles. Doing things like plank exercises or even yoga stretches like bird dog or cat and cow, you guys can look those up, will be really beneficial for you. But if you want to get rid of the back pain and actually see what's causing it, we definitely recommend taking a picture of the low back to see what's going on.
Yeah, and what she means by picture, mean x-rays.
Yes,
okay,
exactly.
So x-rays evaluation to see exactly if there's arthritis in there, if there's any sort of degeneration, how the disc and the nerves are breathing in there, and that'd be the best thing if those exercises and strengthening doesn't work for you.
Yeah, so we're here to answer any of your questions. We would love to evaluate you, see if there's any misalignments in your low back, and see if we could help you with that. You could find us at www.thenewhealthcc.com. Again, I'm Dr. Vanessa Rodriguez.
And I'm Dr. Tommy Wolf.
And we'll talk to you guys soon. Bye.
Yes.